So good morning. I'll enter my patient's room, do my hand hygiene. I'll introduce myself. Good morning, my name's Claudia. I'm gonna be your student nurse for today. Today we're going over our eyes and ears assessment. So first we're going to test our visual acuity, which we're testing cranial nerve number 2. And we're going to do that with our Snellen eye chart. So, before I do that, actually I want to ask my patient a few questions. So, first question, have you been experiencing any trouble seeing or any blurriness?
No.
Okay. Next question, have you been experiencing any eye pain?
No.
No? Okay. So, we're going to continue with our Snellen eye test. I'm going to have the patient stand 20 feet away. And I'm going to have the patient read the smallest line possible. So first, you're just going to read it normally with both eyes.
V L W Z Q N T O C K S K I.
Perfect. Now I want you to cover one eye and read the smallest line you can.
V L W Z Q N T O C K S K I.
Perfect. And now the other eye, and again, the shortest line.
V L W Z Q N T O C K S K I.
Perfect. So my patient has 20/20 vision in both left and right eyes. That means my patient can stand 20 feet away and see the chart how a normal person would from 20 feet away. So after our Snellen eye test, we're going to come over here. And since we were checking our visual acuity, now we're going to be testing our peripheral vision, which is cranial nerve number 2 as well. And we're going to do this with our confrontation test. So I am going to give my patient a set of cards, and I'm going to just have you put these cards in front of your eye. Okay, perfect. And I'm going to have the cards in front of my same eye, and I'm gonna have, when you see my pen, just look straight at me. When you see my pen coming from the sides, tell me when you see it. Just say now. So I'm gonna start from the side. Tell me when you see it.
I see it.
Okay, I'm gonna come from the top. Tell me when you see it.
I see it.
From the bottom, tell me when you see
I
it.
see it.
And then from the side. Tell me when you see it.
I see it.
Okay. And then switch eyes. And we're going to do the same thing. Tell me when you see
I
it.
see it. I see it.
Look at me.
I see it.
And then one more.
I see it.
Okay, perfect. So after our confrontation test, we're going to do our 6 cardinal positions. So with our 6 cardinal positions, we're testing cranial nerves 3, 4, and 6. I'm going to have you just look straight at me, and without moving your head, just follow your eyes with my pen. So we're going to start off. Perfect. And we're always going back to base. Perfect. So that was our 6 cardinal positions. Now I'm checking accommodations, so keep watching my pen. Okay, you have to look at it actually. So that's accommodation. We're making sure that our pupils go in, that our eyes are coming in to look at the pen, and we're checking to see that our pupils constrict, which they did. So after our cardinal positions test, I want to look at our iris and pupil. I'm making note of our round appearance, our shape of both of our eyes, pupils and irises is equal, and our iris color is green. So from here we're going to check our pupillary light reflex. So here I'm just gonna have you look straight ahead, and I'm gonna shine a light in your eyes, and I'm gonna make sure that the pupil's constricting. So just look straight ahead, don't look at the light. And I'm just gonna go, okay. And we're just making sure that both our pupils constrict, which they do, which is perfect. After that, I'm looking at eyebrows, eyelashes, and eyelids, and I'm making sure they're nice and equal and symmetrical, which they are. I am also, here, let me put this down. After checking pupillary light reflex, I would document that finding as PERLA. So that stands for pupils are equal, round, they react to light, and accommodate. So after we've done our inspection, I've looked at symmetry and everything. We're going to go on to one more thing for the ears, for the eyes, if you come closer. I am checking the sclera and conjunctiva. So if you could look up, please. And I'm just looking down a little bit. Our sclera is nice and white, and our conjunctiva is pink and shiny, which is perfect. And we're gonna finish off our assessment with inspection and palpation of the ears. So first I'm checking the external of the ears to make sure that the shape is nice and equal of both ears. I want to make sure that both my ears are symmetrical. And after that, I am checking the external medius. So that's just going to be right inside the ear. We're checking for any ceramin, which is earwax, which is absent. There is no ceramin, so that's good. After that, I'm going to palpate the pinna for any tenderness or lumps. Do you have any pain? No. Okay. So that's good. And lastly, I am going to do the whisper test. So I'm going to whisper something on each side, and you have to repeat it back to me. You can say it.
White sweater.
Okay, perfect. So this one.
Yellow rabbit.
Okay, perfect. So that concludes our eyes and ears assessment. Thank you for watching.